In 2014, I was diagnosed with bilateral pheochromocytoma.
4 years ago, I find out that I have paraganglioma.
A couple of weeks later, had a biopsy through the esophagus, and that confirmed paraganglioma.
My mom, for example, was diagnosed with a malignant pheochromocytoma in 2010.
At that point, I was referred to a surgeon who put me forward for an MRI scan, which confirmed characteristics of a pheochromocytoma.
Dizziness, headaches, my heart racing, fatigue.
It started off with palpitations, sweating, feeling of fear.
Night sweats, hot flashes, high blood pressure. She had very low blood pressure, so her blood pressure went to normal. She also had some irritability and mood aspects to it.
At that time, I had lost over 100 pounds, but suddenly I began to have really high blood pressure spikes.
They did a multitude of testing and told me that my thyroid was elevated, that it was just anxiety, and there was nothing wrong with me.
Originally, it was just facial paralysis, and I was diagnosed with neuropathy.
He diagnosed me with cluster headache.
The doctor was pretty sure at that time that it was a blocked artery of some kind.
Her family doctor always said that this was an elongated menopause. This went on for 7 to 8 years.
10 centimetre tumour sitting above my kidney and behind my liver.
At that time, we were told that it had metastasized to her abdominal wall and her liver.
Not only 4, but 7.
At this time, I don't have any other family members or any family history. So currently I'm classified as sporadic.
In 2014, we found out that my family has familial paraganglioma syndrome.
I think the reason I'm making this video is because I would like to help towards the knowledge and the research of this rare disease. I am one in a million apparently, who have this type of tumour.
I'm making this video to make people aware of this very rare disease. I'm very blessed to have survived.
I'm making this video so that hopefully it can bring awareness to other people about this disease, bring awareness to doctors so that they think about the disease when they're treating patients who have high blood pressure, who have headaches, who have pallor and sweating.
I had struggling with these especially because the doctors has not a lot of knowledge about paragangliomas.
I want doctors to recognize us when they see us, and I want most doctors to at least have heard of this disease and know some basic tests to run.
And I really hope that this touches somebody's lives. And if you have symptoms, don't stop. Keep going. Keep persevering.
I'm going to continue fighting, and I know one day we're going to be tumor-free, hopefully.